around the world on the CBC News app and CBCNews.ca. We are, as we have come to get used to, standing by for the Prime Minister's daily update on the federal response to the pandemic. Justin Trudeau will be speaking just a day after his government unveiled billions of more dollars for businesses to try to keep Canadians working. We could be hearing more details about that rescue package today as Ottawa rushes to not only protect Canadians' health, but the Canadian economy during this unprecedented shutdown. And that, of course, is the door, the Prime Minister's front door at Rideau Cottage, where we are expecting him to come out in about 15 minutes' time. A couple messages to tell you about this morning, and I'll bring in my colleague Vashi Capellas, who's joining me again on this Saturday. Pretty sure it's Saturday, Vashi. Oh, we've got a little problem. We'll get that sorted. There we go. There is a cruise ship. I just wanted to give this update. There is a cruise ship right now that is stranded, a Holland America cruise ship that is stranded off the coast of Panama that is not allowed to dock. And we've just had a little update from the Minister of Foreign Affairs, who says that he has been in contact now with his counterpart in Panama, that medical supplies are making their way onto the ship. And this is important because there's about 248 Canadians stuck on that ship, and 4 passengers have now died. It's a very precarious and strange situation. They're not allowed to dock. They're stuck on a cruise ship. We know cruise ships have become real problems, obviously, for the virus and the trying to contain a virus on board a cruise ship. But that's the latest update from the minister on that cruise ship. There are new repatriation flights that have been scheduled: Haiti, Honduras, and Ecuador. And Peru, at least 2 more flights starting mid-next week. So just wanted to give people, because I know there are lots of people tuning in around the world who are waiting for information on things that the government is doing to try and get them back. So those are some updates on that front. But let me bring in Vashi if I can now. I think we are mostly expecting to hear the Prime Minister really try and reinforce, first of all, that message that, hey, yeah, it's the weekend, but that doesn't mean you get to go out. This is the new normal, and it's important to remember what public health officials are telling us and have been telling us through the week.
Yeah, exactly, Rosie. And I think today is an opportunity, or at least viewed as an opportunity, for the Prime Minister to drive home that message, as well as the messages that surround or that target the economy that we heard, because we've been, watching all week. But there are still a lot of people who are working, obviously not the majority of people, but who are leaving their house to work. And so the intention behind this morning's communication, my understanding is to reiterate what we have been listening to all week for people who have been at work during the week. So the main messages, obviously, on the public health front is stay home. Don't think that you can leave your house if, for example, you have traveled. There are new rules in place, and in fact, new laws in place, and perhaps penalties if you don't comply with the order from the government if you are returning from abroad and you've crossed into Canada's borders to self-isolate for 14 days. So that's a really particular message that you will hear from the Prime Minister today. We've heard it every single day this week, and we can expect to continue hearing it. The other message, as you pointed out, Rosie, is around the economy. 2 big announcements, massive announcements this week. The first directed to people who find themselves out of work or unable to go to work or to take home a paycheck because of COVID-19. So a big $107 billion package, $52 billion directly in aid. This CERB, or CERB, I'm not sure exactly how I'm supposed to pronounce it now. Basically an emergency benefit that should become available around April 6th for application. In your pocket 10 days later, $2,000 a month for 4 months. A whole host of Canadians are going to qualify for that. So that message will be reiterated. And then, as you said, the big announcement yesterday directed towards those who either work for or own and operate small and medium-sized businesses in this country. A big change from the initial announcement of a 10% wage subsidy to a 75% wage subsidy. Now, the details that I'm still looking for, we may not get them until Monday. The Prime Minister signaled on Friday, but we probably will hear questions about them today. Is there a cap on that subsidy? So per employer, there was one for the 10% one, $25,000 per employer. Is it going to be something similar? Because that would obviously affect the efficacy of that wage subsidy. It'll last 3 months, but who exactly qualifies? Can it be a partnership? Does it have to be incorporated? I think those are the questions that business owners have right now. But obviously, the signal was sent yesterday that there is aid on the way, and I think that message again will be reiterated by the Prime Minister to sort of drive home what some may have missed over the past few days.
And a couple updates just on the state of things in this country as far as the pandemic goes. I will point out that the COVID-19 has now killed more Canadians than SARS did. SARS back in 2003 killed 44 Canadians. We are now at 55. Of course, COVID-19 much more easily spread amongst people, so that would be one of the concerns, and that is why testing is ramping up. What public health officials continue to say, as well as Stay Home Vashi, is that nearly half of the cases are now being caused by community spread. In spite of that, there have been a couple of hopeful notes. In Ontario, we've seen a trend, at least on Friday, where the number of cases is down, which is the first dip in daily case growth seen in weeks. So that to me indicates that the things that people are doing and the message that officials are sending it seems to be working. At least there are some glimmers that it is. Vashi, I'm just going to get you to stand by, if you don't mind. Vashi Kapellas, host of Power and Politics. And let's go to British Columbia, because that is one of the provinces where it does seem that there's a tiny bit of positive news, and we're going to take that when we can get it. It's early days. Health officials warning that physical distancing, though, seems to be working, seems to be slowing the spread of COVID-19.
I'm starting to see some glimmers of hope, if we will, that we've flattened out. Our trajectory has leveled off a bit. We need to see that continue, and of course, ideally, we want to see it go down.
That was BC's Health Officer Bonnie Henry speaking just yesterday. Even though she was hopeful, she did warn, and this is an important message, that the province isn't out of the woods just yet. So for more on what's going on in BC, we're joined by Leanne Young in Vancouver. So I would imagine what no one wants to do is sort of pull back on the measures that are happening across the country and in BC. But tell me how they're reading this and what they're telling people in Vancouver.
Yeah, absolutely, Rosie. I mean, the message from the government is they don't want anybody to become complacent. Yes, there is that glimmer of hope, and it's just the beginning signs that it may be working, but that by no means means that anybody should stop from physical distancing. In fact, we need to be 100% committed to that. That's what we heard from the BC Health Minister yesterday, Adrian Dix, as well as Dr. Bonnie Henry, whom we just heard from a second ago. So yesterday, that briefing was the much anticipated BC briefing, the epidemiological modeling that health officials have been looking at data here in BC and comparing it to some of the worst hit regions, so Hubei province in China, as well as northern Italy. And as from what you heard there is a sign of hope. So based on the data so far, it looks like there does seem to be signs of showing that there is a bit of a flattening of the curve or a falling off of the curve, as Dr. Bonnie Henry says. So some of those physical distancing measures that were implemented about 2 weeks ago, they seem to show signs that they're working. She can't say that definitively if they're working, but they may be working. So some of the data that she's looking at, so if we had not implemented those measures, we should be expecting about a 24% increase in daily new cases. And what we're seeing right now is about 12%. So the exact number she gave was 215 cases per million people compared to 130 million new cases per million people. So those rates both lower than what's in Hubei, lower than what's in northern Italy, but they could change, of course, if we were to have a sudden outbreak, say at a care home or a remote community where there are fewer resources. The other part of yesterday's briefing that was very... Oh, yeah, go ahead.
No, you go ahead. That's good.
No, I was also going to... Okay. I was also going to talk about hospital beds and ventilators, because that was the other big piece of that briefing yesterday. Are we prepared in that respect? And health officials say that we are reasonably prepared. So part of the preparation was met by being able to cancel all of our non-essential surgeries. So that freed up about 3,900 hospital beds. Even if we were to reach Hubei levels of the outbreak, we should be able to have enough hospital beds for everybody. And on the ventilator front, even if we were to reach northern Italy levels, we should have enough ventilators for everybody. There's about 1,200 ventilators in BC, more on order, but of course, I mean, we're competing with the rest of the world, everyone's trying to buy more ventilators at this point. So, I mean, we're reasonably prepared, so that's some more good news there. The most equipped areas, we're talking about the Lower Mainland, so obviously here in Vancouver, and also if you were head out towards the north, that's where you're going to see the fewest equipment. And they're also expecting higher levels of hospitalization if you were head out into the interior, where there's a higher population of an older demographic.
Okay, Leanne Young in Vancouver. We'll take those little bits of hope where we can get them. Thank you for the update. Appreciate it. Part of all of this, of course, is about what we are now calling physical distancing, really staying away from getting close to people and making sure that those rules are followed. Well, in London, Ontario, they have now set up a tip line for residents to call in if they spot people breaking protocol. Jesse Helmer is London's acting mayor. Ed Holder himself is self-isolating after a trip to the United States. Good to see you there, Jesse.
Well, thanks for having me on.
So what is the idea behind the tip line here, and why do you want people to use it?
Well, it's really important that we're following the advice of public health officials, and certainly in London, we've seen people responding overall very well. Usually we have a pretty big festivities around St. Patrick's Day, for example. It seems like a long time ago, 11 days ago, but the students really shut it down and there weren't a lot of parties as you might normally expect. So overall, the response has been good, but we are seeing people who are concerned. They're hearing the message from public health officials to keep the 2 meters apart. And when they're seeing people who they think are not following that advice, they're calling in. So up until recently, they were calling 911, and we want to discourage that. We want people to call the appropriate people about the issue that they're seeing. So we set up a phone number and an email address to give them an outlet to do that, and it seems to be working so far.
And then what happens? You know, you see people walking too closely on the street. You call someone, and then what's the follow up, and what's the consequence?
So the first part is really to divert those calls away from 911, because in addition to what's happening with COVID-19, obviously we have other things that are happening in the communities that are emergencies. We want to keep those lines clear. So this way we can identify if there's an issue, for example, in a particular playground where we have people who are constantly trying to use the playground equipment even though it's closed. You know, we can increase signage, we can send a staff person out there to kind of remind people in person. And I think education is the first message, right? We want to make sure that people understand about the physical distancing to reinforce that message, and that's what's happening so far.
So it's less about vigilantism and more about trying to get people to stay aware and keep doing it.
Absolutely. We don't need any vigilantism at all, and we're really just trying to reinforce the message and giving people an outlet to raise the concerns that they've got, answer their questions. I think it's really important. We've seen dozens of phone calls come in already and hundreds of emails with people who have concerns, and a lot of it is connecting them to the appropriate information and reinforcing it in the places where we're seeing those problematic behaviors. If we can reinforce it on those sites, we're taking those measures now.
And because I know the mayor, Ed Holder, a little bit, he's doing okay. He's just self-isolating as a precaution. Is that right?
He is. He's following the advice from public health officials. He was abroad in the U.S. when all this happened, so he came home as soon as he could. He's been isolating as he should be, and he'll be coming out, I think, on Tuesday. So Ed is doing well, and thanks for asking.
Okay, well, I wish you all well. Stay healthy and good luck keeping everybody doing the right thing. I appreciate it very much. Jesse Helmer, London, Ontario's acting mayor. All right, as we wait to hear from the Prime Minister, I'll bring back my colleague and host of Power and Politics, Vashi Kapelos. So there is some encouraging news. I think one of the, I said again, because it's the weekend, because people see little signs that the flattening of the curve is working, that the physical distancing is working. The worst thing to do right now would be to sort of take your foot off the gas, if you will, and to think that this means you can change your behavior in any way. It certainly does not. And in Quebec, for instance, we saw yesterday 10 deaths in one day, in part because spring break there happened a little bit ahead of time compared to other parts of the country. So I imagine we'll hear more of that from the Prime Minister.
Yeah, I imagine too. And I think that's actually a really good point to underline, and one that we continue to hear from public health officials in pretty much every province. Even though we have that glimmer of hope, for example, through the modeling of BC, it's modeling based on physical distancing that's taking place right now, measures that are in place right now. So if you were to take your foot off the brake and take that as a sign that we can relax, that would change the forecast. That would change the modeling and thus become not as successful or not as able to prevent the increase in cases or the higher increase, the bigger jump in cases. And so I think, and we have heard this continually that from those public health officials rather, there is a lag, right? Like there's a time where you're doing this stuff and you're physically distancing and your stores are closed, and about 10 days to 2 weeks after you've had that in place for a little bit, you might start to see some encouraging things on that curve. Now that doesn't mean that there aren't new cases, and that doesn't mean that you can stop what you're doing, but there is that sort of slide down that proves what we're doing is making a difference. And I think that's why we keep hearing all these questions towards public health officials about timeline. I think everybody sitting at home right now is interested to know, how long are we going to have to live this way? It's just too hard for them to, it's not scientific. They're not scientifically able to know at this point what the exact number of days is, but we are, as you said, starting to see some signs that what we're doing is beginning to work, and that message will be reiterated.
All right, here he is now, the Prime Minister of Canada, on this Saturday with his briefing.
Usually a time where we get to get together with friends, spend some time with the kids, with family. Obviously, this is another different Saturday as we've had over the past few weeks. We need you to continue to stay home. We need you to continue to do everything we can to flatten the curve. Obviously, there are sacrifices we're all making, but it's beginning to work. We see promising news out of BC that over the past couple of weeks, the measures taken in place by so many Canadians, the choices that Canadians have made have had an impact on the overall numbers, but we need to keep it up. We need to continue to do what is necessary to prevent the spread of COVID-19, which means continuing social distancing, continuing to not go out unless you absolutely have to, continuing to think about caring for each other, thinking about protecting each other, and thinking about protecting our healthcare workers and those essential workers who are doing such extraordinary service to keep things going, to keep us safe at the same time. C'est une responsabilité que nous partageons tous.
This is a responsibility that we all have, to stay home and to do everything we can to prevent any extension of this pandemic or it hurting other people. Here on this beautiful Saturday, we should all be staying home in isolation and not be taking any steps that might put at danger our healthcare workers or our loved ones. But as you know, we have been encouraging people to stay home, particularly if they have symptoms of COVID-19.
People, particularly if you feel the onset of symptoms of a cold, of COVID-19, you need to stay home. You need to isolate. You need to not travel. People have been following that, but I can enhance that we have formalized some of the domestic travel rules. As of Monday at noon, people showing any signs whatsoever of COVID-19 will be denied boarding on all domestic flights and intercity passenger trains.
Today, I'm announcing that Transport Canada has introduced new rules for travel. Obviously, we've been saying for a long time that if you have any symptoms of COVID-19, you must not travel, you must stay home. But starting now, or rather starting on Monday at noon, if people try to travel by plane or through domestic means or by train, they will not be allowed to board if they have any symptoms whatsoever of COVID-19. We must continue to keep a safe distance from each other. We must continue to protect ourselves, and we must continue to make the responsible decisions. Again, I want to thank the millions and millions of Canadians who are doing precisely that. It's extremely important so that we can all stay safe and so that we can ensure that when this crisis is over, we can go back to a normal life and continue to have a prosperous and healthy country. But it requires that everyone do their share now and in the coming days and weeks. Last night, I had an opportunity to do something that I love to do. I was able to spend some time with members of my youth council. And for me, spending time with young people, even if it's through audiovisual means, it's great because it gives me energy and it helps me to realize just how much young people are involved. I was with Minister Bartosz Chagger and two parliamentary secretaries, Darren Fisher and Adam Vaughan, and we had an open discussion with young people from the council right across the country.
I was able to have with the young people on the Prime Minister's Youth Council last night were extraordinary. Obviously, lots of questions and comments around COVID-19 and vulnerable populations from the north to internet access and broadband access for rural communities, questions about what young people can do, questions around what they can tell their friends who are doing well or not doing well, conversations about mental health as well, because obviously this is a moment of anxiety and stress for so many people. This was a great conversation, like so many of the great conversations being had amongst Canadians across the country. Our young people specifically, we've been counting on them over the past years to continue to step up in the fight against climate change, in the fight against poverty, in supporting a better world internationally and at home. And we continue to need young people to be that vehicle for building a better future and sharing messages. Obviously, young people, like every generation, are chafing at the bit in terms of having to be self-isolated, particularly at a time when we tell our young people at an age where we say, now is the time to go out and discover the world, whether it's with a backpack or in a laboratory. Make new discoveries, challenge yourselves, challenge the world. And they're looking at their plans for the spring and their summer jobs, and they're realizing that there is a massive anxiety and a massive uncertainty out there. But that doesn't mean we're powerless. Doesn't mean they're powerless. On the contrary, this generation of young people is so committed and engaged to creating a better world that we need you to keep leading the way you are. We need you to share your messages with friends. We need you to lead by example. We need you to be challenging and discovering the world in virtual ways. There are ways that you can continue to shape the future we all live in every single day, not just with your choices, but with your leadership. And that's what we need. On a besoin que nos jeunes continuent de mettre au défi ce monde,
our young people to continue to challenge the world, to continue to push people to do what is possible, and to want to be the leaders that we need. And during these times of crisis, we need that even more. So I'm counting on you, and I know that the present and the future are in very good hands with our young people. We are going to be there for you. As young people, we know that there are many out there who may not qualify for the emergency benefit. Others will be supported through their businesses if they work part-time as a result of the assistance we're providing to PMEs. But we will continue to find other ways to ensure that you remain confident not only about the future, the present, but about the future as well.
Help people. Yes, young people who will, many of them qualify for the CERB and be helped through the payroll subsidy that the wage subsidy we're creating for businesses and bringing up to 75%. But there's always going to be more to do, and we're going to keep listening and looking how we can make sure that Canadians get through this in the best possible way by supporting them now and ensuring that we can roar back stronger once this is all done. That's why we put forward big measures to help businesses over the past few days. Increasing the wage subsidy to 75% means businesses across the country are now realizing they're going to be able to keep people on their payroll, keep that relationship going between them and their workers, and even rehire people who they didn't think they'd be able to support over the past 2 weeks. We know that what we do now to hold things together, to give people the ability to stay home, to isolate, to hold through this difficult time is key to how we will come back stronger afterwards. But we need to stick together and we need to do it. On a besoin
We need to look at everything we can do, every one of us, to come through these difficult times. And that's why we provided assistance to small and medium-sized businesses. We are also facilitating access to credit. Cash flow will be very important for people these days in order to borrow money, for example, if they need. And we've made loans of $40,000 available, interest-free for the first year, and you will not have to pay $10,000 of that if certain conditions are met. So we will be working together to ensure that we have the ability to come through this. Our plan of $107 billion was passed by Parliament, and we are going to be starting to deliver that aid to Canadians, and Canadians are anxious to receive it. But we're working as fast as we can, as hard as we can, to deliver that to Canadians as soon as possible. This is an unprecedented situation, but that's exactly what we're going to do together. The Canadian Emergency Response Benefit will provide $2,000 every month for the next 4 months to Canadians. And I'm inviting you now to apply on Mon Dossier, Revenue Canada, so that you can apply as soon as the portal is open in the next few days. And if you can, register as well with a direct deposit so that the money is put directly into your bank account.
Canada Emergency Response Benefit will give people $2,000 every month for the next 4 months to help get us through this time. I know an awful lot of people have showed interest in it already. My recommendation to you is to go on the Canada Revenue Agency site and sign up in advance through the My Account links. Once you do that, in the coming days, when we're able to start actually opening applications, you'll have a head start. And if you can, please opt for the direct deposit option, which will let you get this money into your bank accounts sooner and is simpler for everyone as well. There are lots of things that we're doing to make sure that we get through this together. But everything we do, we need to do together. Every single individual, every single household has its role to play in making sure that Canada and Canadians do well through this. We also have a role to play in making sure that the world gets through this, both by modeling solutions and demonstrating what can be done when we all work together. This is going to be key, particularly as parts of the world that are much more vulnerable are beginning to get harder hit. We need to be able to get through this so we can help rebuild a world in which people can prosper and everyone has a real and fair chance to succeed. I know Canadians are up to this challenge. I know we're going to do this together. J'ai énormément confiance dans les Canadiens.
I have a great deal of confidence in Canadians and our ability to come through this because we do what we always have to do in these difficult times. We're there for each other. Thank you and have a great Saturday.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant passer à la période de questions en commençant par le téléphone. 4 questions avec suivi. Modérateur, c'est à vous.
Merci, thank you. La première question est de Michel Lamarche de TVA Nouvelles. La parole est maintenant à vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. First of all, I'd like to hear more about the new rules that will be coming into effect by Transport Canada. Has this prompted you to reflect on tightening up the interprovincial borders, or maybe you're not at that stage yet? Well, we do recognize that there are a great many Canadians who are already self-isolating. They have changed their behavior, they're no longer traveling, and we're going to have to continue to do that, all of us. At the same time, we recognize that there are some people who need to travel in order to deliver essential goods and deliver food, and we would not like to take steps that we absolutely do not need to take right now. But as I said, we will always look at what is needed, and we will take whatever measures are necessary at the right time, if they become necessary. But for now, that is not something we are planning to do in the short term.
Obviously, Obviously, people across the country have been doing an excellent job of staying home, of not traveling for anything that's not absolutely necessary, and we encourage people to continue to do that. However, there is essential transport and travel that is happening as merchandise, as food gets delivered across the country. We need to continue to ensure that that's happening. Every step of the way, we're going to look at whether we need to take further measures to keep Canadians safe and to keep our economy rolling on essential goods. We will make those decisions as they are needed to be made, but right now we're not looking at closing provincial borders.
Suivi, Michel?
There are snowbirds coming back today. We can see them at La Colle, and the SQ has been there to tell them to respect the quarantine. But there's a lot of confusion about people coming back and what they're supposed to do. Mr. Trudeau, when they arrive in Canada, are they allowed to take walks or ride their bike under the Quarantine Act? What applies to them? Well, the Quarantine Act says that people have to self-isolate if they're coming back from traveling, and that's extremely important. We need people who might have been exposed overseas or in other countries to not transmit COVID-19 to the rest of the population, which is trying to protect itself. So we're asking everyone to follow the rules and the advice from Health Canada and the Canada Public Health Agency.
Prochaine question.
Merci. La prochaine question est de Mélanie Marquis, La Presse. Votre ligne est ouverte. À vous la parole.
Merci. Bonjour, Monsieur Trudeau.
Thank you. Good morning, Mr. Trudeau. Why? Which buses that travel between the provinces are not included in this new measure? Well, Transport Canada's measures apply to industries that are within federal responsibility. Now, obviously, there are industries that do not fall within the federal government's purview, and we are now putting measures in place so that people do not travel if they have symptoms of COVID-19. Now, obviously, if people have symptoms, we ask them to stay home. But at this point, they won't be able to take a plane or a train.
We recognize, and we've told people who have symptoms that they need to self-isolate, they need to stay home, they should not travel. Now there will be Transport Canada rules coming into place that will prevent anyone indicating symptoms to travel by airline or by train.
Suivi, Mélanie?
Yes, on another subject, Mr. Trudeau, about the U.S. and Canadian border. We understand that the U.S. is turning back some people at the border to their native country. And I'm wondering what you think of this. Well, we are currently in an unprecedented situation in the history of our country and perhaps in the history of the world. And our ability to respond in order to protect Canadians and prevent the spread of this virus are, by definition, exceptional measures. We will do everything we can to reflect our approach and our values, but we must protect Canadians during this difficult time, and that's exactly what we're doing.
Prochaine question.
Merci, thank you. The next question is from Rod Nicol from Reuters. Your line is open. Please go ahead.
Premier Kenney said yesterday that he'd like to see a coordinated North America response to OPEC's actions to flood the world with oil. He suggested ideas like tariffs on Saudi oil and an anti-dumping case. Do you support these ideas, and do you support the more aggressive approach to OPEC's actions recently?
Obviously, we are very concerned with OPEC's decisions that are putting at risk the livelihoods of people around the world, particularly Canadians who work in the oil and gas sector. We are focused on helping those Canadians, helping people who are hardest hit by economically by COVID-19. The measures we've put in place will support Canadians right across the country, including in our oil and gas sector. But we also know it's a sector that has been particularly hard hit, and we will look for further help to be able to support people as they get through. In terms of international collaboration, coordination, we continue to be part of conversations on this issue around the world.
Would you look at a more aggressive approach to Saudi Arabia?
I think this is a moment that we need to focus on getting through COVID-19 as best we possibly can. I think there will be a lot of reflections on how various countries behaved in this particular moment. Our focus right now is on making sure we can support our citizens and stabilize the global economy the best way we can, which we are doing through our membership in the G7, in the G20, in various international fora and approaches that we have, while at the same time focusing on making sure we're supporting Canadians and keeping them safe.
Merci. Dernière question avec suivi au téléphone.
Merci, thank you. The next question is from Teresa Wright from the Canadian Press. Your line is now open. Please go ahead.
Good morning, Prime Minister. On the cruise ship anchored off the coast of Panama, what actions are being considered or will be taken to help the 248 Canadians aboard?
We have worked directly and contacted directly the Panamanian government to try and get an ability to bring those Canadians home. We know this is a very difficult situation for them, for their families. A lot of people around the world are worried about being able to get home. A lot of their family members here are feeling anxious and really want to see them brought home. I can tell you that the entirety of Global Affairs Canada employees are single-mindedly focused on this Herculean task of bringing Canadians home any way we can. And much of it involves negotiating with other countries to get permissions to cruise ships to dock, permissions for airplanes to lift off from their country where they've closed airspaces. We're going to continue to work diligently to do everything we can to get all Canadians home and provide significant consular support both in the meantime and to those people who are unable to get home.
Louis Blouin de Radio-Canada. Monsieur Trudeau, est-ce que vous pouvez être plus précis un peu dans la mécanique pour ces nouvelles mesures annoncées pour les vols,
how these new measures will work for trips by train and plane? Who will be enforcing this? Will it be the airline companies? Because we saw that for international flights, there are people who did board flights even though they had symptoms. So how exactly can you be sure that this will be properly enforced? We expect those rules to be followed. Yes, it will be the responsibility of the companies to ensure that people who show any symptoms of COVID-19 do not board a train or a plane. We know that it is essential that people avoid travel that is non-essential and that any person who has symptoms of COVID-19 be self-isolating and stay home.
It is extremely important that people be following the rules. It will be important for operators of airlines and trains to ensure that people who are exhibiting symptoms do not board those trains. It'll be a Transport Canada rule that will be enforced. But at the same time, we're telling people, stay home if it's not absolutely essential for you to travel. Stay home absolutely if you're exhibiting any symptoms of COVID-19, of a flu-like virus. We need you to keep yourselves safe. We need you to keep your loved ones and your neighbors safe. And we need you to keep from overburdening and endangering the safety of our healthcare workers and others who are doing so much to keep us safe as a country.
On assistance for the provinces, you have provided $500 million for healthcare needs, but there are provinces having a lot of problems, Alberta, Newfoundland, and Labrador. Will there be another phase of assistance for those provinces that are in a very precarious situation right now? We are dealing with an unprecedented situation. We need to be there for each other, and the federal government will seek to help any province or any individuals or any businesses that are in trouble because of COVID-19. We continue to look at what we can do every single day and what we must do, how we can do more, and we will continue to work hand in hand with the premiers of the provinces and territories and other leaders right across the country to ensure that people have the necessary assistance.
We recognize this is a situation without precedent, a situation that is beyond our collective and individual experience, and that's why we've made the commitment to help people who need help getting through this time, whether it's an individual, a family, a business, or indeed a province. And we continue to work every day to look at ways that we can help, look at how we can help, look at what we can do to help. Those conversations will continue to be ongoing for individuals, sectors, or indeed provinces that are facing particular difficulties.
Marika Walsh with the Globe and Mail. I want to revisit the energy sector question. Earlier this week, Finance Minister Bill Morneau said it was hours or days until the energy sector would find out what specifically the government would do. So when are they going to get the answers that they need?
We're continuing to work to try and provide workers in the energy sectors with the support that they need. We recognize that the collapse of oil prices around the world is hitting hard people who've been extremely hard hit over the past years already. That is why we need to get this right, and we're working with provinces, we're working with industry, we're working with various sectors, including unions and others, to try and make sure that on top of the help we're already giving of $2,000 a month to people who are laid off, 75% wage subsidy so companies can keep people on the payroll. We're going to continue to make sure that once we are through this difficult time, people in industries and places right across the country are going to be able to pick themselves up and get back to work and have our economy continue to work strongly like it was before. It's going to take a lot of effort in the meantime, and it's going to take us doing different things and trying different things. But we are going to keep working until we manage to help everyone.
Hi, Ashley Burke, CBC News. As you mentioned at the top of your speech, you said that there have been encouraging signs out of British Columbia. Are you worried at all that Canadians will hear about those encouraging signs and become complacent?
I think encouraging signs is absolutely something we want to see. We want to see a decline in the rate of transmission, but people need to know that the decline in the rate of transmission happened because 2 weeks ago, people started heeding these instructions and started self-isolating and started engaging in social distancing. And over the intervening weeks, people have increased their following of advice, and that is an excellent sign. But if we're seeing a reduction in the spikes, that means what we are doing is working, and we therefore need to continue doing what we are doing. We are not out of the woods yet. Obviously, if the measures we're doing are working, we need to continue doing them, and that's why as a government we're making sure that people are able to continue doing what they're doing by flowing money to households, by supporting businesses with a 75% wage subsidy, by making access to credit that much easier. We're going to continue to do more things as we look at ways to help Canadians get through this so we can come out of this strong without a reappearance or resurgence of the virus afterwards.
If we start to see some positive results in a few places, it is because 2 weeks ago they started to follow the advice of Health Canada, in other words, to self-isolate and prevent the virus from spreading. So that means that the measures we have brought in are working, and they must continue to be applied. People must continue to self-isolate and maintain a safe distance from others so that we can really prevent the spread of COVID-19. And we will have to continue for quite a while again if we want to remain safe and see a decline in the number of cases and a flattening of the curve. And that's why we're giving so much help to families and businesses and communities. That's why we're making access to credit easier so that we can continue, in spite of the current difficulties, to follow that advice, because that will allow us to come out of this faster and in a better situation.
Domestic travelers getting on planes and getting on trains, and is it going to be based on the honor system? And if so, there have been cases of Canadians lying so they can continue to travel. How do you prevent that?
We are asking Canadians and telling Canadians that they need to remain home. They must as much as possible, avoid non-essential travel. This is something that is essential if we are going to get through this together. Obviously, if anyone is exhibiting symptoms of COVID-19, they should not go out. They should stay home. They should not travel. And we are giving further tools to airlines and rail companies to ensure that anyone exhibiting COVID-19 symptoms does not travel. Okay.
We have been very clear in saying that people have to stay home and avoid non-essential travel. Of course, particularly so if someone has symptoms of COVID-19, that person should self-isolate and stay home and not be traveling for whatever reason, other than going to the hospital. But there are ways to do that safely. People should not be taking planes or trains if they exhibit any symptoms of COVID-19. And right now, we are providing new tools to our transportation companies so that they can ensure that those people do not travel.
CTV News. The government has shut its Service Canada offices because it deemed frontline workers there doing face-to-face work with the public was too risky. But we're still asking many Canadians, grocery store workers, bus drivers, nurses, to do this very same risky work. Are we going to do anything more to mitigate the risk these frontline workers face and anything to personally assist them further?
We recognize that as much as possible, services need to be shifted online or onto the telephone. That is why we've moved to close Service Canada offices so that people can access these greater resources online because people will be there to work and respond to them virtually and online, while at the same time creating opportunities to actually support people who do need that extra help. But of course, there are people who have to continue to go out and work. We think of grocery store workers, we think of emergency responders. There are people who are putting themselves at greater risk every day to provide essential services to Canadians. And yes, we need to do everything we can to protect them, but each and every one of us can do things that will protect them as well. Ensuring that we're only going out for groceries maybe once a week, ensuring that we're cutting down on our movements, that we're not in situations where we're going to have to call on emergency services or essential personnel for any reasons other than absolutely essential reasons. And that means staying safe and staying at home. Yes, there's things that businesses and governments are doing in order to keep frontline workers as safe as possible. But every single Canadian has things that we can do that will reduce the risk for grocery store cashiers or delivery people who are continuing to get food to our doors. These are the things that we all need to be responsible for because people out there doing essential services for us need to be protected.
We recognize that not putting people at risk by having online services available is a good way of preventing the risk to people who can work from home and don't have to do it face-to-face. We also know that there are workers who will have to continue to work in our stores, in our grocery stores, that they will have to be there, for example, to respond to emergencies. So we, with these companies, are trying to do what we can to make these employees safer, but I think as citizens and as consumers, we can all do things that will lessen the risk for these individuals, whether it is only going to do one's grocery shopping once a week or not calling on emergency services. And there are many, many things that we can do and that we must do to protect the people who are there to help us, who are providing essential services in this difficult time. And I invite everyone to reflect on what they can do to allow those people who do that essential work to remain healthy.
First of the month is coming up, and many Canadians are going to have to pay their rent. And while the $2,000 a month is a good start, it doesn't roll out until after that. And then thereafter, it might not be enough to cover the rent of many people across this country. So what are you hoping will happen, or what are you hoping can happen for those who can't make rent, considering that you have worked with the banks to help people defer mortgages? What about renters?
We're very much looking at different things we can do. At the federal level, we are limited in our tools. Much of protections for renters and relationship between renters and landlords are provincial areas of jurisdiction, but we are, of course, continuing to work with the provinces on ways we can do that. Access to credit through banks will be helpful as well, as we recognize people are using their credit cards for more and more things, and those balances are piling up, and they are really concerned about things. At the same time, we can point not just to the Canada Emergency Response Benefit, but things like the Canada Housing Benefit, which will be coming out in Ontario in the month of April, will help vulnerable people be able to pay their rents. There are many different methods that we're trying and looking at in order to support Canadians through this difficult time. I recognize the anxiety with the beginning of the month coming, and we're looking at ways we can help people get through that.
Brian Mullen at Global News. Prime Minister, wanted to ask you for an update on your wife, Sophie. Has she been cleared by doctors, and how is she doing?
Sophie is feeling great. My family is doing well. My kids and myself, we're all doing well. We continue to follow the direct advice of health professionals on what next steps are. But like I said, we've asked people to stay at home and work from home as much as possible, not go out if they don't have to, and that certainly is something that we're doing and encouraging everyone to do. Sophie se sent énormément mieux.
Sophie feels much better now. She's in fine form, in my opinion, and the children are well as well. They're healthy, and we are continuing to follow all the advice of experts, like everyone should be doing, and like everyone should also be doing. We should stay at home and stay isolated as much as possible, and not go out unless it's absolutely necessary, and always follow public health advice.
Merci beaucoup. C'est qu'est-ce qui mettra fin à la conférence de presse aujourd'hui.
All right, and that is the Prime Minister of Canada speaking to Canadians on this Saturday, something that he has taken to do over the past 2 weeks or so. At the end, asking how his wife, Sophie Gregoire Trudeau, is doing. Remember, she had tested positive for COVID-19 about 2 weeks ago. And while he didn't directly answer the question whether she's been given the all clear by doctors, he does say that she's feeling great. She's in top shape, in my opinion, he said. We're all doing very well, but they are remaining inside the house, staying at home. He is working from home as an attempt to, I guess, practice what he's preaching, which again was part of the message today to Canadians. It might be Saturday, it might be the weekend, but that doesn't mean you can let up. That the government is still calling on people to practice physical distancing and stay home. Let's bring in the host of Power and Politics, Vashi Kapelis, who's also joining me here on this Saturday. A little bit of news, though, from the Prime Minister as well, Vashi.
Yeah, a bit of news, Rosie, that now, in addition to putting further restrictions on international travel, so people traveling from Canada, outside of Canada into Canada, now there will be restrictions on travel within Canada, and namely that if you are showing or displaying any symptoms of COVID-19, you will not, according to the Prime Minister, as of noon on Monday, be allowed to board trains or planes within the country. So if you were just flying between Toronto and Ottawa or Toronto and Vancouver, if you are displaying those symptoms, he says you will not be allowed to board the plane or the train. I think a couple of things to note on the specific announcement. I know that one of our colleagues was asking why it doesn't include buses. It looks like that is provincial jurisdiction, and that that would be like under various responsibilities where provinces are concerned. We also know there is reduced bus capacity after much of Greyhound stopped operating a little while ago. Also, a question from our colleague Ashley Burke around how this will be enforced. And we know this is a sort of pertinent question because the Quarantine Act was applied just a few days ago, meaning it became against the law to not self-isolate when you came back from outside of here. But how are these measures going to be enforced? And the only answer the Prime Minister provided was that there would be further tools for the airlines and companies that operate the trains in order to make sure that people without symptoms are not allowed to board. I'm not clear, though, on what exactly that means or what happens if you do board and you do end up showing those symptoms. I know from a lot of anecdotal evidence, a lot of messages that we get in that there are some issues with that whole process, even when they're boarding international flights. Like some people think, others are faking it, or there's just a whole conversation that's happening on there. And even though it's within the airline's purview to say don't get on, I'm curious to see how this will work in the domestic context. And also, just a reminder that starts at noon on Monday, according to the Prime Minister.
Okay, and I'll just add a couple things. When he was asked whether interprovincial borders would be closed down, he shut that down. He said no, although we do know that some provinces are telling people they have to self-isolate when they arrive, particularly Atlantic provinces. But I think your point is, the important point here is how exactly will this work? Because it was 10 days ago that Canada ordered all airlines to prevent travelers with symptoms from getting on planes when they were coming from elsewhere, and the health check is very much an honor system. You have to sort of disclose that you have these symptoms unless they are apparent, and we have done some reporting. Dave Seglins did some reporting just this week that showed that people in a desperate attempt to get home are not being truthful about their symptoms and are getting on these planes anyway. So I'm not sure what this actually will do domestically either, given that they're already having trouble enforcing it internationally and on plane rides outside of this country. I'm just going to get you to stand by, Vashi, if you don't mind. We are waiting for our regular federal update at noon from, I believe we're just going to hear from Dr. Nuge, who's the Deputy Public Health Officer today. But I wanted to make sure to get into Julie Nardi. She's a respiratory therapist at Sunnybrook Hospital in Toronto, and she's joining me now. Julie, thanks for making the time. I really appreciate it.
Thanks for having me, Rosie.
Tell me, what's the situation like right now at Sunnybrook ICU?
Well, at Sunnybrook, we've taken a number of steps to increase capacity for the influx of ICU patients that we were expecting. So we have a COVID-19 unit, and it is almost at capacity with patients. We've been really, really busy trying to manage these patients effectively, but our teams have done an incredible job trying to keep everyone well and managing under these extreme circumstances.
And how are you doing for personal protective equipment, for ventilators, all those things that we're hearing about that we know frontline workers are worried about?
Well, the big concern is masks right now. It's no surprise that we're running short on supplies. We have Sunnybrook's taken the same stance as many of the other GTA hospitals, in that we're being allocated now 2 masks per shift, per 12-hour shift, per employee that works in a clinical area. And so that's been very challenging, because if you have to go into a patient room, it's hot, you've got a lot of equipment on, and the sweat is pouring down your face, and you wonder how protected you really are. So it's a big concern. People are worried, but they're doing their best. They're very resilient. The team is amazing, and we've really been working hard to just provide the most optimal patient care.
Health workers are really at risk, obviously, of contracting this virus. We've seen it in Italy. So many of them have actually died. How worried are you about your own safety?
Well, it is a big worry. Every day I've been working 12, 14-hour days and been away from my family to do that. But, we have to be super vigilant. Like, hand washing is the best thing you can do. The public needs to know that, of course, but especially for us in the hospital environment, we're really, really diligent about hand hygiene and ensuring that we are applying our N95 masks when we need them very appropriately, so that we, can ensure that we're protecting ourselves, because ultimately myself being protected means that I'm protecting my family too, and that's what's most important.
Julie, I wish I had more time. Can I just say thank you from all of us? I know things are not going to ease up anytime for you either. So take good care of yourself, and we wish you good luck. And thanks, really, sincerely, from all of us. Thank you.
Thank you.
Respiratory therapist Julie Nardi, she's in Toronto. Okay, we are going to pull away from coverage on the main network on CBC now, but just update you on what we did hear from the Prime Minister today, that domestic travel now on planes and trains, you will be prevented from getting on board if you are showing symptoms of COVID-19. This follows the same designation or the same decision about 10 days ago when it came to international flights. The Prime Minister also saying that if you are waiting or hoping for that emergency benefit, it would be wise to go to the Canada Revenue Agency website and pre-register right now so that you can get it as quickly as possible. That wraps up our coverage here on CBC on the COVID-19 pandemic. We will be back again tomorrow at this time to bring you all the latest. We will continue our coverage on CBC News Network and CBC.ca. I'm Rosemary Barton. Thank you for watching.
This is a CBC News special presentation.
Hello again, I'm Rosemary Barton here in the nation's capital, where we are waiting at this hour for an update from health officials and federal officials on the state of the pandemic in Canada, COVID-19. This, of course, a regular update and a regular briefing that we have been getting from officials every day at around this time. I believe today we're just going to get one person. Sometimes we have the whole panel of different cabinet ministers. Today I'm being told it's the Deputy Health Officer, Dr. Howard Nuge, who will bring us up to date on some of the key numbers. Perhaps there'll be another person, but that's the last that I heard. And again, today we also heard from the Prime Minister on this Saturday. I'll bring in the host of Power and Politics, Vashi Kapelis, who's here with me as well, helping with our coverage. One of the things that the Prime Minister was asked, along with making news about that domestic travel, Vashi, was about, and I believe it was our colleague, Ashley Burke, who asked the question, was about the fact that we are seeing some encouraging signs, particularly in British Columbia, that the social distancing or the physical distancing, measures seem to be working right now. We know that because BC shared extensive modeling that it had done with the data that it has. I know the Prime Minister this week promised that they would also show some numbers and some data, which I understand they're very reliant on the provinces to get that information, but would definitely be helpful, I think, for people, for Canadians who are, one, struggling to understand where we are in this pandemic, but also people really desperate to know when it will end, which I don't think anyone can answer. But sometimes when you can see, the curve and the trend line, that does help you to get a handle on things. But maybe I'll just put to you that the message around, if you see a glimmer of hope, what the Prime Minister was saying around that.
Yeah, unsurprisingly, the Prime Minister reiterated a message that we have heard from public health officials in every single province and at the federal level, and that is that even if there are signs of encouragement, that is not a time to take your foot off the brake. It's in fact a time to double down on them. And the Prime Minister was actually pretty specific on this. For example, don't go out if you don't have to. Don't go to the grocery store more than once a week if you can allow for that. Don't go to work if you don't have to. I mean, he provided a number of examples, and I think the message continues to be. And it is a difficult line to walk, I think, even from the perspective of public health officials. You do want to, of course, I think there is a hunger for that data among all of us, right? We want to know if all of these sacrifices that people are making, all the stress that they're under is for the reason that we're being told that it is. And so that data is very important, but at the same time, it's not going to be conclusive at this point. This is not an hour-long, and we've heard this from Dr. Nuge multiple times this week. This won't be hours. This might not even be weeks. It could be months. And so you want to encourage this behavior, and you want to know that it's going in the right direction. But at the same time, you don't want Canadians and all of us to sort of see, oh, well, maybe we don't have to go as hardcore right now because it looks like things are on the right track. And so we heard that messaging from the Prime Minister. I would imagine we'll hear it from Dr. Nuge and other provincial updates throughout the afternoon. And you had mentioned earlier, Rosie, there are some glimmers of hope, but we should be, it's not the case everywhere. And we have seen, for example, in Quebec, particularly where we know travelers returned earlier than in much of the rest of the country. Their March break is about a week or nearly 2 weeks in some instances earlier than March break in other provinces. We have seen huge numbers in that province and even 10 additional deaths just yesterday. So, a note of caution underlining any good news at this point, certainly where data sets and overall trend lines are concerned.
Yeah, and I would say that the testing is increasing. For instance, I know British Columbia, I think, has done the most testing. That last time I checked, they had done the most testing. The country overall has tested more than 170,000 people, and we heard from public health officials yesterday that indeed we are sort of in the top, 5 at any rate in the world for testing per millions. But there's a wide understanding that more testing is needed, and more testing is better because then you can understand, of course, where the virus is, where it's going, and how to contain particular outbreaks in particular parts of the country. But you're quite right. Even though there is some suggestion of good things happening in British Columbia, it would be wrong to think that is the picture across the country. It would particularly be wrong in Ontario to think that things have let up, even though we saw a little change yesterday. And I would also point to what the Prime Minister said about why they're seeing that in British Columbia, and it's a point you made at around 11 o'clock at the beginning of all this, and that is that it's because British Columbia started this 2 weeks ago that they are seeing some changes now. And if you look at Ontario, for instance, spring break started, I believe, March 13th, right? That was the Friday the government said you shouldn't leave. People left anyway. That was a decision that they made. And so a week from that is really when the 2 weeks of physical distancing starts for Ontario. So you probably won't see whether any of that has worked for, as you said before, 10 to 14 days. And you may actually see numbers go up because the travel continued at the beginning of March for a lot of people, and snowbirds are returning as well. So that also creates different problems. Of course, they now are being told you have to quarantine. That is the legal requirement. Okay, we'll come back to you, Vashi, after this press conference, if you don't mind. We're going to take you now to okay, they're both there. Dr. Theresa Tam, the Chief Public Health Officer, and Dr. Howard New, he's the Deputy Public Health Officer. Let's listen in live for their update.
There are 5,153 cases of COVID-19, including 55 deaths. In addition, at any point in time, there are many other people under investigation, awaiting laboratory results, or not yet tested. So even if you are not hearing of cases in your community, it doesn't mean there are no cases or that there are no exposures waiting to happen. We have now completed tests for over 184,000 people in Canada, which is more than 84,000 additional people tested since Monday. In terms of the severity of COVID-19 in Canada, the percentage of cases that require hospitalization is approximately 7%. About 3% are critically ill, and 1% of cases have been fatal. Please note that 30% of those hospitalized are under 40 years of age. We continue to keep a close eye on the severity of the disease because although there will be day-to-day fluctuations, a sustained trend of increased severity could point to a higher rate of infection in vulnerable populations or that the health system is being overwhelmed. I am reminding Canadians not to underestimate the severity of this disease. The devastating impacts of COVID-19 is evident in Europe and parts of the United States. At the same time, there are signs of hope. There is a note of cautious optimism from British Columbia, the area of Canada that first experienced community transmission. It is still too early to know for sure, but after weeks of public health interventions, the rate of growth appears to be slowing. We will be closely looking at BC over the coming week for better clarity on the effect of their public health measures. This early sign of reassurance should spur us to keep up with our new habit of physical distancing, despite the accompanying hardships. So we need to stay the course. Yesterday, we started a challenge for Canadians to build a bubble of protection and stay inside that bubble. We need to maintain this zone of protection around us to keep the virus out. Each of us should ideally have our own separate bubble that is a 2-meter circumference around us. But for couples, families, and other cohabitation situations, that bubble might mean 2 or more people, or keeping within a bubble that no one else comes into. So the important thing is to stay in your bubble and not burst someone else's. I'd also like to ask people to just check out our Canada.ca website for a new interactive map on cases in Canada, as well as a more detailed epidemiologic report that's now been posted in our 2 official languages. Thank you.
Bonjour. Au Canada, 5153 cas ont été déclarés, dont 55 décès. Par ailleurs, à tout moment, de nombreuses autres personnes font l'objet d'une enquête, attendent les résultats de laboratoire ou n'ont pas encore été contrôlés. Même si aucun cas n'est signalé dans votre
Even if you're not
collectivité,
hearing about cases
cela
in
ne
your
veut pas
community,
dire qu'il n'y a pas de
that
cas
does not
ou que
mean
vous
that there
êtes
are no
à l'abri de
cases
toute exposition.
or that there
On a des résultats
is
des
no
analyses
possible
laboratoires
exposure.
pour plus de 100
We have now completed
84
tests
000
for over
personnes au Canada,
184,000
soit
people in
plus de
Canada.
84
That
000
means
personnes supplémentaires depuis
that
lundi.
84,000 more people have been tested
En
since
termes de
Monday.
gravité de la COVID-19 au Canada,
In terms of the
le
severity
pourcentage de
of
cas
COVID-19 in Canada,
devant être
the
hospitalisés
percentage of
est
cases that
d'environ
require
7%.
hospitalization
Les
is
personnes
approximately
gravement malades
7%.
représentent environ 3% des cas.
3% are critically ill,
ont été fatals.
and 1% of cases have been fatal.
De près la gravité de
We
la
are
maladie.
continuing to keep a close eye
Malgré
on
les
the severity of the
variations
disease.
Si la gravité présente une tendance
Although
à la hausse,
there will be day-by-day
pourrait traduire
fluctuation,
un taux
a
d'infection
sustained
accru
trend
dans
of
les
increased
populations
severity
vulnérables
can
ou un
point to a
débordement
higher
du
rate of
système de
infection
santé.
in vulnerable populations
Je
or
souhaite
to
rappeler
the
aux
health
Canadiens
system being
de ne pas
overwhelmed.
sous-estimer la
I am
gravité de
reminding
cette maladie.
Canadians not to
Les
underestimate
effets
the severity of
dévastateurs de la
this disease.
COVID-19 sont
The devastating
évidents
impacts
en
of
Europe et dans
COVID-19
certaines parties
are
des
evident
États-Unis.
in Europe
Il y a
and
aussi
in
des
some
signes
parts of the
encourageants.
United States.
La
At the same
Colombie-Britannique,
time, there
où la
are
transmission
signs of
communautaire
hope.
est apparue pour la
In
première
British
fois au Canada,
Columbia,
par
the
un
area of Canada
optimisme
that first
prudent.
experienced community
Il est encore trop tôt pour le
transmission,
savoir avec
there
certitude,
is some
mais après des
cautious
semaines
optimism. It
d'intervention
is still
en
too
santé
early to
publique,
know for sure,
le
but
taux
after
de
weeks of public
propagation
health intervention,
semble
the rate
ralentir.
of growth
Nous
appears to be
surveillons
slowing.
attentivement les situations
We will be
en Colombie-Britannique
closely following
au
the
cours de la
situation in
prochaine
British
semaine,
Columbia over
afin
the
de
coming
mieux
week
comprendre
in
l'effet
order to
des
better
mesures de santé
understand the
publique
effect
qui y ont
of
été
their
prises.
public health measures.
Ce premier signe
This
encourageant
early
devrait nous
sign of
motiver
reassurance
à
should
maintenir
encourage
notre
us
nouvelle
to keep
habitude de
up with our new
pratiquer
habit
l'éloignement
of
physique
practicing
en dépit
physical
des difficultés
distancing,
qui en
despite
découlent.
the fact that it's
Il faut
difficult.
garder le cap.
We
Hier,
must
nous avons
stay the
lancé au
course.
Canada le défi de créer
Yesterday,
leur bulle
we
de
started a challenge
protection
for
et de
Canadians to
rester dans
build
cette bulle.
their bubble of
Nous devons
protection and
maintenir
stay
cette zone de
inside that
protection
bubble.
pour
We need to
empêcher le
maintain this
virus
zone of
de nous
protection around
atteindre.
us to keep the
Chacun
virus
de nous
out.
devrait
Each of
idéalement
us
avoir
should
sa
ideally
propre
have
bulle
our own separate
d'environ
bubble
2 mètres
that
de son
is a
circonférence.
2-meter circumference.
Cependant, pour les couples, les familles,
But
les
for
personnes en
couples,
situation de
families, and
cohabitation,
others in
cette bulle peut
cohabitation
inclure 2,
situations,
4 ou
the
encore
bubble
plus de
might
personnes,
include
toutes
2,
isolées
4,
dans
or
une
more
bulle
people,
où personne
all
d'autre
keeping
n'entre.
within the same bubble that no
L'important,
one
c'est de
else
rester
comes
dans votre
into.
bulle
The
et de ne
important thing
pas
is to
faire
stay in
éclater
your
la
bubble
bulle
and
de
not
quelqu'un d'autre.
burst someone else's bubble.
On encourage aussi tout le monde de visiter
We
notre
also
site web
encourage you to check out
canada.ca.
our website,
Merci.
canada.ca. Thank you.
Thank you. We will now open the telephone line to questions. Vous pouvez poser vos questions dans l'une des deux langues.
You can ask your questions in English or French.
Question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics to ask your questions. Operator, over to you for one question on the line.
Thank you. Merci. Please press star 1 at this time if you have a question. The first question is from, la première question is de Lauren Gardner de Politico. Your line is open. Votre ligne est ouverte.
Hi, thanks for taking my question. I'm wondering what kind of advice you might be providing to federal officials and maybe even officials at the local and provincial levels who may be concerned about the U.S. relaxing certain social distancing measures in the coming weeks. There have been reports of mayors in border towns who have expressed some concerns. Is there any direct advice you've been able to provide to them thus far about how to handle that possibility?
Absolutely. We are monitoring what is going on in terms of the actual outbreaks in the United States. And of course, there are many different areas of the United States that are quite heavily impacted by COVID-19. So I think, as everybody knows, that there are now border measures to reduce the impact of any illness that might come from travelers in the United States. And those are layered measures, and certainly no non-essential travel between the two countries is very key, while maintaining essential services and those links that are so important between the two countries. But we've also, as you know, have now a mandatory quarantine order in place, emergency order, that essentially mandate those travelers to undergo 14 days of self-isolation. So that's mandatory isolation if they've traveled anywhere, including the United States. We will be, of course, isolating anyone who is sick coming from any country, and that includes the United States as well. And the Quarantine Act, the Federal Quarantine Act, comes with it quite heavy penalties if people were not observing that order.
And one follow-up?
I'm set, thanks.
Okay, operator, next question on the line.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque de la Presse canadienne. Your line is open. Votre ligne est ouverte.
Hello. I have some questions in French for Dr. New. Yesterday, you explained the situation and you said that it might last for months, which is not very encouraging. What can Canadians expect? Will we be in isolation for an extended period, for several months? Will we be under quarantine for about a year? What information do you have for Canadians? Thank you for this question. As I said a few moments ago, we can't predict what will happen in the future. But there have been encouraging signs. For example, the situation in British Columbia. The number of cases is decreasing in British Columbia. And this may be a sign that the curve is flattening in British Columbia, or even in Canada. It's important that we stay the course, that we not give up. We must continue to practice physical distancing. And we'll monitor the situation week by week, and that way we'll be able to determine the impact that our collective actions are having in slowing the spread of the virus. Follow-up question. My next question is about Prime Minister Trudeau's announcement that he made today. He said that Canadians who are symptomatic will no longer be able to board planes or trains. As a public health official, here's my question for you. How will the employees of airlines and rail companies assess the situation? Will they be taking passengers' temperature, for example? What instructions do you have for them at this point? Thank you for the question. It's been a while now that we've been telling all Canadians to stay home if they are sick. We expect that Canadians will follow the instructions of public health experts and stay home. As for airline employees, We will be monitoring passengers before they board planes abroad in order to see whether they are symptomatic, but we can't guarantee anything with 100% certainty. But here's the important thing. If you are sick, do not travel. Stay home.
The question was...
Thank you.
In English? Okay, the question was for what should, I guess, companies train in airplanes, et cetera, for domestic travel that the Prime Minister just announced. What we're saying is that the message is really, in a sense, at the core, no different. We've been saying from a public health perspective for several weeks at least that if you are sick, stay at home. So really, I think there is an obligation, I would say, a civic duty for people to understand that if you are sick, you should not be taking a commercial travel means such as an airplane, a flight, or taking a train to go anywhere in the country. You should be staying at home. Of course, the people actually are the personnel working for the airlines and the trains. They will do their best. They'll look at people who want to board and look for obvious signs that someone's ill, etc. But in terms of very systematic screening, there's no guarantee. You know, people can always hide symptoms, take Tylenol. So I think at the end of the day, it really comes down to our collective understanding and collective, I think, motivation and approach to do the right thing. If you're sick, don't travel. Stay at home.
Thank you. Now we'll take a question in the room.
Hi, Ashley Burke, CBC News. Can you tell me about plans to run field hospitals, why they might be needed down the line, and how soon are you estimating that they would be needed in Canada?
So that's there's a significant amount of planning in the provinces and territories. A good example would be from British Columbia, even yesterday, where they have very systematically planned out different scenarios and exactly how much capacity they have. Public health is going to do whatever it can to reduce the impact of this epidemic so that you don't go beyond your capacity to cope. Having said that, of course, you have to prepare for much more worst-case scenarios. So those things are absolutely happening in the provinces and territories. We've been in contact with them on a daily basis. So they are already planning alternative care sites, how to care for people who are not so sick outside of the hospitals designated for COVID-19, for example. And so the idea is they're freeing up ICU beds and also the intensive care, more serious illnesses have to be taken care of in a hospital setting, and then how to look after people who could be looked after in more alternative sites. So all of that is at play, even though right now Canada is coping. So those calculations, I would actually encourage people to just have a look at the example of British Columbia, where the numbers are actually quite well articulated.
My other question is, you talked about the optimism in BC and the modeling done there. Will the federal government be sharing their same sort of modeling publicly with us?
Yes, so absolutely. As I said, there's an epidemiologic report that's already being posted. At the federal level, we have to take into account a national picture, which I think is very important, and looking how we're trending in comparison with other countries that have gone before us, if you like, and looking at their experience and where we're tracking. So that is absolutely the intent. I also want to flag that the national aggregated picture must be supplemented by the provincial and local picture, because different areas of Canada are actually experiencing this outbreak. It's just slightly different trajectories and timelines. So unpacking what's underneath a national picture, I think, is very important. So I am, of course, very happy that British Columbia has done that. We've been supporting different provinces to do their own projections as well.
And sorry, when are you planning on releasing that publicly?
Well, some of that data is already now, since today or last night, already on our website. We'll be making as much of that available as possible. I'll have to just caution that, of course, modeling is modeling. That's just, planning scenarios. What you have to look at is the epidemiologic report in real time where things are trending.
Thank you. Next question in the room.
Hi, Ian Wood, CTV News. Today, the Prime Minister announced that there's going to be further screening on domestic travelers, air travel and train travel. Should we not be taking these steps at a local level? I mean, what good is it if we're screening someone traveling a long distance within Canada, but not someone, say, getting on a public transport bus or riding in a taxi?
So there are, I think you would actually observe that all across Canada, the provinces and the municipalities are taking this really seriously. They're already stopping gatherings. They are advising this 2-meter distance on transportation. And so that includes buses and other things where as much as possible you're doing physical distancing. So all of those measures are already being implemented in the local jurisdictions. While maintaining as a balance, society does have to go about as much as possible maintaining essential functions while doing physical distancing. But obviously each of the municipalities, the cities, in very different situations. Toronto isn't going to be the same as a more rural area, for example. So I think that every level of government is doing whatever it needs to maintain that physical distancing.
If I could just add to that, sort of my previous answer is that certainly governments, companies, and so on can put whatever measures in place. They're never going to be foolproof. Someone can hide symptoms and so on, take a Tylenol if they do have a fever. So I think at the bottom line, it really is, I think, the collective responsibility, but for each citizen here in Canada to understand and appreciate it's important that the important role they can play. If you're sick, stay home. Don't take public transportation.
And one follow-up?
Yeah, my second question was on with regard to the United States. Obviously, it's a bit of a wildfire situation there. Cities like Detroit are hotspots, also in Washington State near the border. I know you've spoken a bit about this, but there has been concern addressed by, say, the city of Windsor across the river from Detroit. Should we be satisfied with the ban on non-essential travel, or do we need to step up our border enforcement and border closures with the United States, granted that the somewhat reckless direction they are taking?
So I've just said it's not just reducing the non-essential travel. We do have a emergency order under our Federal Quarantine Act that then are ordering travelers to isolate if they're sick, but also mandatory quarantine or essentially of anyone who is asymptomatic. So they will have to go directly home, depending on if they have a home, and if they don't have a home, the federal government will be housing people in our federal quarantine facilities. So, and as I said, the penalties are pretty heavy. Now, let's just say that even on a daily basis, we do have instances. We have truck drivers who have been stopped and been put in a federal quarantine site because they've shown even mild symptoms. So that's happening in real time right now. And then they get tested, and then if they're okay, they can continue. If they're not, they're staying at our quarantine sites.
Thank you. Operator, over to the line for 2 questions.
Thank you. Merci. The next question is from Teresa Wright from the Canadian Press. La prochaine question est de Teresa Wright de la Presse canadienne. Your line is open. Votre ligne est ouverte.
Good afternoon, Dr. Tam. Yesterday, we heard that the number of patients in ICUs doubled in Ontario in less than 2 days. How concerned are you about this spike, especially considering that ICUs were the first parts of hospital systems to be overwhelmed in places like Italy and Spain?
Yes, so I think that's, as I said, we have to monitor the severity of illness very carefully because if there's increase in critically ill people, the key spike is going to occur if health systems are overwhelmed. So having enough ICU facilities is very, very important. So that has to be tracked. Right now, all jurisdictions are coping with the numbers, but they are planning to do more. Even Ontario and BC and many jurisdictions have actually emptied out probably about half of the ICUs just to make sure that they are already prepared for any influx. But of course, from a public health perspective, we just do not want people to end up in the ICU. So on the prevention side, based on what we understand, a lot of the ICU patients in a number of jurisdictions are people, say, from long-term care facilities. They are the older population and people with underlying medical conditions. And that's why we've really, really stressed that we have to protect these populations. Otherwise, we would have more ICU admissions. So I think unpacking the epidemiology underneath the people who are being critically ill does show us that they are the vulnerable and they are the elderly. And so long-term care facilities, making sure that nobody sort of introduce the virus there, and absolutely no introduction into hospitals and other places where vulnerable people go, but also on an individual level, do not go anywhere near someone who's vulnerable or older in your family even, or your friends. Do not try impact them, because you will see increase in serious illness if that is the case. So maintain that bubble and definitely keep the bubble away from anyone who is vulnerable. But based on what I've seen so far, the health system is able to manage their patients.
And one follow-up?
Yes, and just on the announcement today from the Prime Minister on passengers on domestic flights and trains not being allowed to board if they're showing symptoms, can you provide any more details about exactly how that they will be screened and how those new powers being given to airline companies and train companies will be enforced?
So I think those details will come in the coming days, and obviously working very closely with the Minister of Transport, and that is that I think the media and the public will get the information as that unfolds. So stay tuned.
Thank you. Operator, next question on the line.
Thank you. Merci. The next question is from Mélanie Marquis from La Presse. La prochaine question est de Mélanie Marquis de La Presse. Your line is open. Votre ligne est ouverte.
Merci.
Thank you.
Juste un peu pour suivre la question de ma collègue. Qu'est-ce qu'on
This is a
devrait
follow-up to my colleague's
faire
question.
spécifiquement, ou qu'est-ce qu'on va faire
What should we do specifically? What will be done
pour les
specifically
employés des compagnies
to
aériennes
protect
pour
airline
contrôler
and
les
train
symptômes?
companies?
Prendre la température?
How will they
Est-ce que,
assess
donc,
symptoms?
c'est à eux
Will
que
they
revient
taking
ce
passengers'
fardeau-là? Puis vous, juste
temperature?
concrètement nous dire ce qui va
Does
se
that
passer à
burden
partir
fall
de
on their
lundi dans les
shoulders?
trains et pour les
And
compagnies aériennes?
will this be occurring as of Monday
Merci pour la
on
question.
trains
Comme
and
Dr.
flights?
Tam a dit,
Thank you
nous
for the question.
continuons à travailler étroitement avec nos
As Dr.
collègues
Tam
de
said,
Transport
we
Canada,
are
aussi
working
avec les
closely with our
compagnies des lignes
colleagues at
aériennes, aussi
Transport
pour
Canada, as
Cambia
well
Rail,
as with train and airline companies, train companies such as Via Rail.
exactement c'est quoi les
We are working
protocoles.
with our
Donc,
partners
il faut attendre un peu
to
parce
develop
que
a protocol.
c'est juste annoncé
This will
et
take
des
a little
détails vont
while.
sortir bientôt.
The announcement was just made, and we will have
OK,
details
mais
soon.
juste pour précision, là, puis ensuite j'aurai une question de suivi.
Okay, but could you clarify
on entend
something,
beaucoup
and then
de
I'll ask a
témoignages
follow-up
d'électeurs qui
question.
disent que ça fonctionne pas à
We've heard a
l'aéroport,
lot
que
of
les
people
gens
saying that
pensent
things
que
are not
c'est
working at the
qu'il y a
airport,
pas vraiment
that
de filtre de contrôle.
passengers
Donc là, vous venez
are
ajouter un
allowed
fardeau
to
supplémentaire
board
à une
flights
situation qui
unchecked, that there are no
déjà semble
controls.
problématique.
And
Puis, juste
so
ma
the
question
situation is
suivie aussi,
already
Dr. New,
problematic.
qu'en est-il
And
de
here's my next question for you, Dr. New. What about chloroquine and hydroxychloroquine?
Le Canada a une position à ce sujet-là? Est-ce que des tests cliniques
Does Canada have a
sont menés
stance
juste
about those drugs? Are there clinical trials ongoing in Canada? Thank you for those two questions.
Les protocoles,
Your first question was about protocols
à nos frontières aussi pour les
and
compagnies,
procedures
comme j'ai dit plusieurs fois que oui, on a
that
tout un système,
travel companies will
qu'est-ce
follow.
qu'on fait à nos frontières, même avec
And the answer is yes, we have a
surveillance
protocol,
aussi
we
pour
have
les
procedures. It's
passagers
exactly
avant
what's being done at
embarquement
our borders, and it's
pour un
what
avion
is
ou même
being
pour un train
done for all
maintenant,
those
peut-être
who
à partir
currently
de lundi.
board planes and
Ça fait
trains.
partie seulement une couche
And
d'un
as of Monday,
système, avec plusieurs couches et un système intégré parce que c'est pas
we
seulement
have a
à nos
multifaceted,
frontières ou
integrated
avec
system.
un transport en commun, on va
We have measures at our
garantir qu'on
shared
va
border.
on va prévenir tous les cas d'infection.
We are trying to prevent all infection. That is the job of all governments, and that is also the responsibility of all Canadians. Everyone has a part to play. We are asking those who are sick to stay home and to not take public transit. That's the first thing. Second thing, of course, we want airline and train companies' employees to be safe. And if passengers are visibly ill, visibly symptomatic, they will not be able to board. This is just one aspect of our measures. If a passenger seems ill, that person should immediately self-isolate. The federal government has jurisdiction over our international borders. So the federal government is responsible for all travelers who arrive at our international borders, be it at our airports or at the Canada-US border. There are two elements to our response. First, for those who are symptomatic, we will take care of them. We will put them in a hotel or in another federal quarantine facility. Or if they are not symptomatic, we will tell them to immediately go home and self-isolate. For asymptomatic travelers who are not ill, who do not exhibit any symptoms, they must also go home immediately and stay home because that is a federal quarantine order.
Okay, I can't remember what I said.
Thank you.
Screened at airports or just for domestic? What we've been saying is that any screening, be it at our international borders, at the airports, or even now domestically at train stations or people boarding a domestic flight, is only one aspect. It's never 100% guarantee that we're going to stop further transmission of infection. Personnel at train stations, even at the airports, looking at passengers about to board domestic flights, they'll be doing what they need to do in terms of looking for people who have symptoms of obviously illness, if people look unwell, but that's never a guarantee. We know people can hide symptoms by, for example, taking a Tylenol or so to mask a fever. And so at the end of the day, I think it's not just a responsibility of governments, airline companies, train companies. It's a responsibility of every Canadian. If you are sick, stay at home. Don't take the chance of exposing others to the infection that you have. So I think that's about as clear as we can say it, and we've said it many, many times, and I think it bears repeating. So the other point I was making was that for travelers who come at our international borders, that is under federal responsibility mandate. So it's very strict since obviously March 25th when we put a new order in. All individuals, travelers who come to Canada from outside are subject to a mandatory quarantine order. And that's very straightforward. If we find you at the border, I mean collectively the Government of Canada agents, and you are sick, we will either put you in a federal quarantine facility and look after you and make sure that you get the proper care and treatment. Or if you have mild symptoms, we will arrange for transportation to get to your home for immediate isolation, to not leave your residence until obviously you're declared to be recovered. For those travelers who come at our border who do not have symptoms, who are looking and feeling well, they are also under a federal quarantine order. And they are also ordered to proceed directly to their residence and stay there. As I said before, that means very strictly that they should not be leaving their property. They should arrange for family and friends to get groceries for them. It's quite strict. To be honest, one of the things that we recognize and we're working through with provincial authorities is that at the end of the day, it's a federal order, but these people live in provinces and territories. And so obviously what happens in Nova Scotia, it may be in a rural setting, someone has a farm, it may be obviously easier to comply with the federal order and stay on your property than if you, for example, you live in a condo in Montreal. We recognize it and we're working through that as well. Thank you. La prochaine question pour français pour hydroxychloroquine. Je sais, des essais qui sont en train d'examiner
There are currently trials that are looking into whether it is an effective treatment. Thus far, there is no evidence that hydroxychloroquine is an effective treatment for COVID-19. We are following all experiments in Canada and around the world with this drug. It's important that people be aware that this is an important medication, an important drug for treating other diseases. And so we don't there to be a shortage of this medication to treat other conditions because people think that it's a treatment for COVID-19. There is no conclusive proof that hydroxychloroquine is an effective COVID-19. However, we do know for a fact that it is effective for treating other medical conditions.
Back to the room.
Thank you. Once again, please press star 1 on your telephone keypad if you have a question. De nouveau, n'hésitez pas d'appuyer sur étoile 1 pour toute question. The next question is from Kira Ferguson from Sudbury.com. La prochaine question est de Kira Ferguson de Sudbury.com. Your line is open. Votre ligne est ouverte.
Thank you so much for your time. I was just wondering what, I know obviously our travel restrictions in place for travelers coming over the border in any direction, but for our cross-border workers, what restrictions are being placed on them in one direction or the other?
So those that are providing some of the essential services or that their daily work happens to be across the border, even though they have we're not asking them to stay in a certain place for the 14 days. There are strict directions to them of self-monitoring. They have to avoid crowds, do all the social distancing measures that we expect everyone to do, and monitor the symptoms and report them. We're also have been in touch with employers for setting up measures to monitor the employees as well. So if you are going across the border for any reason, there's a collective responsibility on behalf of the employee and the employer and the governments who are trying to ensure the safety of each other's citizens. And so it is not to say that these workers can do whatever they want. They must essentially self-isolate as much as possible. They have to do the social distancing and monitor the symptoms.
Okay, but there is, as you said, obviously no strict isolation, no 14-day isolation upon their return. They are welcome to attend a grocery store or seek other services in town if necessary?
So the direction is to avoid crowds and avoid contact with the public as much as possible. Say, if you were a pilot that's just come in, and of course you have to fly back out again in order to do your job. But what public health is telling them is go straight to your hotel, do not leave the hotel, get your food ordered, and go back on the plane, basically.
Perfect. Thank you so much. If I may, a follow-up question?
Sure.
Are there any additional cleaning measures in place for the products crossing the border, as there are concerns that the virus could remain on the products themselves? I apologize, products or goods or services being shipped, not services, but goods being shipped across the border to the U.S. or those being received into Canada. Are there any additional cleaning measures to these products before they're distributed to the public?
We'll follow on that because obviously is to do with other departments, but we work very close with them and we can get the answer to your question as a follow-up.
Thank you.
Thank you. We'll take a question now from the room.
Hi. Yesterday, the health minister talked about how they were trying to procure ventilators at a federal level for all the provinces and territories, but mentioned that there were a couple provinces and territories in particular that were trying to order these themselves, so that they weren't getting them through the federal government. Do you know what provinces those are, and what's the problem with that?
Well, I think obviously different provinces can procure different products. At a time when there's a general scarcity in supply, we absolutely encourage jurisdiction to come together and be part of our collective purchasing. So that doesn't necessarily preclude jurisdictions. But there's many advantages in being part of the bulk purchasing because everyone is looking for the products. And if we pull our requirements together, we will stand a better chance to get access to some of these as well. So the federal government can help with if the product comes from another country, one can help facilitate some of those access and transportation and distribution, for example. So it's a collective measure, but we cannot essentially dictate what individual jurisdictions might do. But collectively, we stand a much better chance to get access to scarce resources. But on top of that, the federal government has added an extra layer of protection, which is even if no orders have been placed for the provinces and territories, we're actually purchasing them preemptively should they be required.
So sorry, what provinces are going out on their own and getting their own ventilators rather than federally?
I don't have that specific information, but we certainly encourage everybody to be part of that purchase order.
And the data you just mentioned that was uploaded on your website last night, can you tell us what your big takeaway from that is that Canadians should know when you look at that new data, what kind of a picture it paints?
Well, I think certainly this is a serious illness. And so the picture it will paint is that there are definitely serious consequences of hospitalizations, ICU, care requirements, as well as, of course, the mortality or the deaths. So, but I think it would also tell us that even though some of the severe impacts on the older population, it doesn't mean that the younger population isn't impacted. There's the bulk of the illnesses are actually in the younger age groups. It's just that, and some severe illnesses do occur, but while the heaviest impacts are on the older age groups. I think also it is there to set a sort of national trend to see where things are trending. And as I've just said, well, BC, of course, is an area that was first impacted, but it will show you the curves for each of the jurisdictions and where the cases are. So if you clicked on the map, yes, it'll show you the number by province, but it'll show you the sort of numbers over time for each of those jurisdictions as well. So trending, so national surveillance is important for trends. And there'll be some sort of, as I said, sort of age group breakdowns as well. I just want to emphasize that, of course, if the trends are slowing down a bit, our key message, though, is not to sort of relax. Our key message actually is to double down, absolutely double down. And that right now is an absolutely critical time. And if you looked at those numbers, you realize that we're definitely not out of the woods and we got to keep going. Donc, lâche pas la patate.
We must keep it up.
Thank you. Next question in the room. This will be the last one.
There's some reports in the United States that the CDC is going to recommend this week that all Americans going out in public are going to wear masks. And while we've talked about masks before not being wholly effective for members of the public, if the CDC were to go ahead with this, is that something that perhaps will be headed to in Canada? And can you just speak about whether that's something we should be considering?
Well, we'll always evaluate new data as it comes along. Our position right now is that put a mask on someone with symptoms if they should need essential services. Like if you have symptoms, you have to stay at home. You should not be wandering around the community. If you need to get to a medical facility, at that point in time, that mask might actually be useful because you now have infectious droplets that you might send to others. But the key is to keep that 2 meter distance. Masks have to be utilized appropriately too. Most people haven't learned how to use masks. So there's many practical aspects of this. So our advice right now is there is no need to use a mask for well people.
OK, merci. La séance est maintenant terminée. Thank you.
All right. All right, that is our daily federal briefing from today. The Chief Public Health Officer, Dr. Theresa Tam, and her deputy, Dr. Howard Nude. No cabinet ministers there today, not because they're not working, but they weren't part of the briefing today. I will tell you that as the briefing happened, some new data was posted on Public Health Agency of Canada's website, and you heard Dr. Tam talking about it a little bit. I'll bring in the host of Power and Politics, Vashi Kapellas. I know she was looking through it as well. I just want to say one of the statistics, though, that Dr. Tam gave right off the top that I think really hit home for me and I think is worth repeating for other people. While the number of tests has gone up, the hospitalization of Canadians that have been hit by COVID-19 is about 7%. But Dr. Tam made it very clear that of that group of hospitalizations, 30% of those people are under 40. And I just hammer home that point because I know that there is perhaps a misconception that it is primarily vulnerable or older people that get easily infected. And while they are those that end up in the most dire situations, we are seeing a lot of people under 40 now hospitalized, Vashi.
Yeah, a lot of people under 40 hospitalized, and also another sort of piece of data that came out amongst the big chunk of it that Dr. Tam was referring to is that actually the people who are getting this, testing positive for it, are in the age groups of, I think, 20, sorry, I want to pull up the exact, they're the younger age groups, basically. I was just looking at that data right now. The highest number of cases, 40 to 59 years old, then 20 to 39, and then 60 to 79. However, the last group of people, 60 to 79, represents about 56% of hospitalizations. However, again, you're absolutely right that she was trying to underscore the message, and Dr. Tam said this herself, that this is the seriousness of the disease, right? So that idea that a lot of us have that just because we're not 65 or over, this won't affect us in a serious way, the data is not bearing out. As you said, 30% of those hospitalized are under the age of 40. And just that top line number that she provided, 7% of the cases so far in this country have resulted in hospitalization. 3% of those cases are in critical care, and 1% have passed away. So we're looking at a mortality rate at this juncture, and I keep on qualifying it because the data moves quickly, obviously. So it's important to know this is a snapshot in time, but at this time, a mortality rate of 1%. Some really interesting data throughout that. And the other big thing I'd throw out there that I think is important for all of us to understand is the community transmission versus travel-based transmission. We know so much of this began with people who had traveled, and that's still a huge risk. But we are seeing a shift overall. If you look at the overall number of cases, about 60% of them are now from community transmission, 40% are from travel, and of the more recent cases, it's almost a 90-10 split. So the bulk of these cases right now are being transmitted in our own communities, which is why the measures, the sort of messaging that we've heard from public health officials like Dr. Tam is of the utmost importance as we speak. The travel stuff is super important, but so is staying inside, only going to the grocery store, once a week if you can. All of the stuff that we keep hearing about physical distancing, that is what will slow the rate of community transmission. And community transmission is where this virus is spreading right now.
And that, of course, as we saw travel being limited more and more and more, that is predictable that it would move to community transmission. But you're quite right that that is the primary concern for everybody right now. And it is why the Prime Minister earlier announced this move as of Monday at noon, that if you present any symptoms of COVID-19, if you're trying to board a domestic flight or domestic rail travel, you will be prevented from getting on. It's not really clear at this stage, I'll just end on this with you, Vashi, how that will be enforced, given that we know even international flights, sometimes people are not truthful about their symptoms. It's really an honor-based system, and it will be here again.
Yeah, honor-based, and we did get a release with some more details. There are very few details provided by the health officials. They're sort of very much focusing on the idea this is up to you. No details provided on enforcement by the Prime Minister, but the release says that it will be, the onus will be on the operators, so the airline operator or the train operator, to ask questions, and if they see any visible signs of it, they can deny you boarding, and you will not be allowed to board unless you can present a medical certificate at some point saying that it wasn't COVID-19 or 14 days days have passed. So some details out there right now about what operators of either rail or planes, airlines will do, but as far as what happens if you don't comply or how it will be enforced, I mean, it's already a difficult time for a lot of these operators right now with layoffs and things like that. So I think those details, we await them. As I mentioned, they weren't provided yet in either of the briefings that we received.
Okay. Vashti, thanks for your help with our coverage today. Appreciate it.
Thanks,
Appreciate
Rosie.
being here on a weekend, even though no one really knows what a weekend is anymore. Appreciate that. That was the Prime Minister and federal officials briefing here on our CBC News special. We will be back again tomorrow at around the same time, probably exactly the same time. But there will be more updates from provinces across this country on the COVID-19 pandemic through the day. So stay tuned to CBC News Network and CBC.ca for all of your updates. I am Rosemary Barton. Thank you for watching. Take care.